Welcome to PetVets Online. My name is Dr. Sedone. I'm the owner of PetVets Animal Hospital. We thought this would be a great opportunity for us to show you what it is that we do in terms of behind the scenes. And so with that, I think we're going to take a tour through the hospital. So come on with me. We're going to do a virtual tour right through this door. Employees only. Okay, so let's head on back. And cameraman, if you can follow me to the left. So over here is our tech station. So we have gone digital about 7 years ago. So all of our files are actually right off of these desktops. And so any given day when you call in and you speak to one of our technicians, they would probably be posted here in one of these stations. So in here is our Dr. Grotto. On a normal busy day, which is not during this time period in which we're trying to really limit staff, we'll have up to 5 veterinarians in this room at once. This is my station. The reason for the fun flowers here is because this just happens to be my birthday today, and so I came in to flowers and Rice Krispie treats. So over here is Dr. Barron's station. This is Dr. Sachdev, Dr. Forty, and Dr. Santiago. Let's move on. So our lab area, we have 2 microscopes. This is our newer scope where we do a lot of our cytologies and urinalyses as well. My older scope is still alive and well. This scope is well over 30 years old. Any of you who actually know anything about microscopes, you can see that this one's actually turned around, it's backwards. It's because I'm a southpaw, and it's really helpful for me to drive in the opposite direction from everyone else. But on any given day, these scopes are used to look at urine samples, to aspirate lumps and bumps, and we take a look at the cytology in-house, and of course, the ever-present constant supply of poop, as you can see our little sign for diarrhea. So not that you'd be able to notice this, but most of the time during our workday, this particular area smells like you know what. Back in here we have our in-house labs. These 2 boxes, they don't look like much, but we can do a whole spectrum of in-house chemistry and complete blood counts. So we can do this for our pre-anesthetic patients and also our critical patients, which need lab work done very quickly. The chemistry machine can actually produce a whole sequence of chemistry results looking at kidney values, liver values, electrolytes within 10 minutes or less. All right, so cameraman, we're going to go ahead and pan around and keep walking through. No, they won't talk after here. This area here is our central treatment area. So it was just in use very recently, but a lot of patients that coming back will actually be either on one of these countertops or on the floor to be worked with. The cage bed for in-house hospitalized patients or preoperative, postoperative patients is right here. And we also have, I'm going to turn this light on so you can see, we have an area for patients. Oh, we probably don't want you in the video here. I'm going to pan around here. Sorry, buddy, I didn't get your permission for you to be on film. But we have an area where we can keep larger dogs in more comfortable runs. Those particular runs, as well as all of our cages, have mats for our patients' comfort as well. We're going to walk on in here. This is radiology. So those of you who are familiar with x-rays from a long time ago recognize that we have no dark room in here because for the past decade or so we've had the digital x-rays. So we take our normal x-ray on a unit such as this, and immediately the picture is translated and put into digital form, and this can be viewed in any one of our monitors as well as seen off-site through the image data bank as well. Our original ultrasound machine lives here as well. So this lady here is 8 years old. That's actually fairly old for an ultrasound. Ultrasounds seem to have a life expectancy of only about 8 years. So she's towards the end of her life expectancy, and you'll see the new model that we have in. It's further on back in the clinic, but she still gets used just for more routine type of work. So you may or may not see her in use as we go on. Let's walk through the rest of this. All right, if you notice, all through the hospital we have these green hoses. These are oxygen lines. It allows for us to attach a machine for either oxygen or anesthesia as well. Back in here, where Nicole is sitting right now, this is our dental suite. So it's a separate unit from the rest of the hospital. It allows for us to work with our dental patients when they're under anesthesia and take dental x-rays without disturbing the rest of the workflow through the hospital. So say hello, Nicole. And as you can see, by the way, we're all wearing these really fun masks, right? And this is designed to protect you if you come into the clinic, as well as protecting each other from exposure at this time. In here, we have main surgery. So this black thing here is actually a special heating pad. It does not use normal thermal heat, so you can't burn a patient like a heating pad would. Back in here we have our surgical laser unit, and we'll use this especially when we're doing surgical pallets on those kind of squishy faced dogs like French bulldogs, even pugs as well, and they tend to have a very, very long soft palate, and sometimes it's so long that they can't breathe right. So this is very, very useful in removing that extra length and still treating this outpatient procedure. They can go home the same day, they can eat the same day. You don't get the same issues, same complications that you would see if we were going to try to use a regular scalpel. Next to our surgical laser is our original therapeutic laser. This one is just used for post-op work and post-dental extractions. So it helps improve healing time, so significantly improve healing time, and also it helps in minimizing post-operative pain as well. So we're going to go ahead and move on. So let's kind of spin that camera around. So back in here, we're probably not going to venture down this hallway because that's just where our staff lounge is, and isolation, laundry, some inventory, some of the rest of the hospital, which is a whole lot less interesting. So, but in here is where we have our new ultrasound machine. And so at some point in time, you'll have a chance to actually watch an ultrasound. I'll try to talk you through it as well. And, you know, initially I feel when you're staring at an ultrasound, it's kind of like 50 Shades of Grey. You can't make out the picture. But after a while, if you look at it long enough, you'll be able to see not just the outlines of where the organs are at, but also be able to note pathology as well. And so I would hope that you would join us for some of our ultrasounds as well. In here we also have our therapeutic laser. This is our mobile therapeutic laser. So again, we use this laser very, very routinely to help us manage pain, to help us with wound healing and fracture repair. There's a whole host of conditions in which the therapeutic laser is invaluable. Unlike medication and other conventional means of dealing with these pathologies, there's really no adverse effects to using a therapeutic laser, and it is just an amazing tool that became available to us very readily about a decade or so. All right, so cameraman, let's move on. It's kind of like a maze walking through here, right? All we need is the rat, let him loose and see if he makes it out. All right, back in here, we have our rehab area. is our water treadmill. So on any given day when we have a patient here for water treadmill work, this door is closed. The inside is filled to a certain level. Obviously, this is not a swimming pool, and patients will trek along at variable speeds depending on what it is that they're needing. This actually is extremely beneficial for patients who are post-operative after having orthopedic type of surgeries, for patients that have significant back issues, significant range of motion issues, and even some neurological pathologies as well, because it allows for them to move without having their weight, okay, impact their mobility. And so at some point in time, I'm hoping that I can bring you in here and actually give you a dog's eye view of the inside of the water treadmill as they're working. So we'll see how that works out, and I hope that you join us for at least a couple of these sessions. All right, cameraman, we're gonna back on up. We're gonna pan around. This back counter here is still our rehab area. So Dr. Kelleher and Jenna usually occupy these seats when we have a normal working day. Right now we're on a medical needs only schedule, and so just not seeing much activity at this time. All right, come on, let's keep moving here. Gonna try to not hit Terry. So back in here we have our main pharmacy. As you can see, these white cabinets do have little stickers on them. So it's okay, Dr. Forty, you can walk right past us.
Thank you.
So
There we go. Very
this
good.
is a work day, so I do apologize if we have some interruptions. But this helps us find medications super quick, and because all these white cabinets start to look very much identical when you're trying to reach for medication quickly. So let's go ahead and move back up front.
Either you or I need to get to next.
So again, I welcome you to PetVets Online. I hope that you can join us pretty regularly and take a look and see what it is that we do behind the scenes every single day. Thank you.